skills, and our psych nurse practitioner students are supposed to not only sort of learn the medical side of prescribing and psychopharmacology and all of that comes along with it and assessment, but also like to be able to sit down and be an individual therapist for someone, or to lead a group, or to do family therapy. It's just a big ask. And I do think that's a good point, and a good maybe place to clarify that I do think there's an additional component in the PMH specialty area that it can be overwhelming, the therapy piece. I mean, also do therapy. It's kind of a big add-on. So.
And I'm being very generalizing.
Yeah.
But I feel like you put a lot of emphasis on the experience, like the RN experience as being a good thing. Mm-hmm. And this is not something I've heard a lot before,
that's
honestly.
Funny. Yeah. No, that's good. It's interesting perspective. And I can imagine that. Like I said, I don't think that in my peer group of students kind of going through my program, everyone was like, that's ridiculous. That's not, that doesn't sort of ring true for us. But, yeah, I don't know. Yeah, I guess that's just my own personal perspective on it. Yeah.
I mean, to a certain extent, I will agree with you, because to me, this is advanced practice, so you should have a practice.
Well, I guess that's it, right? Like, and that was sort of as I said, at least I think I've owned my bias, that like I felt that way coming through as in my experience as a direct entry student. I was like, I don't really know what I'm talking about in terms of being a nurse. How can I possibly be an advanced practice nurse who's then going to give direction to these other nurses who know far more than I do about what they're doing? That doesn't feel comfortable. Yeah, so for me, I do, I guess, ascribe to that way of thinking, that it's hard to be advanced at something that you haven't done. But, and just as I sort of made that progression, I was like, I can't personally make that transition without having spent more time as a nurse. Whether that leads to better outcomes. I mean, I don't know. I guess it depends on what you're looking at. Like, do I think that leads to better patient outcomes? I don't know. I have absolutely no data or inkling about whether the care that's provided is the same. I guess my perspective, like, because I work so closely with the students, is just their own, like, their quality of life. And I feel like I guess my assumption is that better quality of life for the provider is probably going to mean better care for the patient in many cases. So I have no doubt that people are going out there and providing safe care. Our direct entry students are going out and providing good, safe care, but the amount of sleep they might be losing in order to do that, and sort of the stress in the first couple years of practice, I think, is probably higher for them, and I feel like that's challenging. So a couple of my students are walking by, but that's kind of so I guess I worry about them and their own sort of transition, that could be really hard.
Do you think that's a professional bias from you being attentive to those things in your patients?
Maybe.
I don't know.
I don't know either. Possibly, yeah. Well, I certainly am. I think probably more aware of like how anxiety specifically sort of can lead to challenges, because I am very tuned into that in my So I do think there's probably an element of that. But I don't know that that's a bad thing. I think to be aware, to be kind of aware of that is maybe helpful.
This is obviously something that you're like very aware and preoccupied by. So
yeah. And I think partially because of my specialty, I think students feel pretty comfortable being pretty honest with me about their anxiety, whereas maybe they wouldn't be as open with other professors about that. And it's funny, in our group and family class, we actually do we practice doing a group specifically about anxiety related to transition to practice. So I hear a lot from my students where we use cognitive behavioral therapy techniques to address anxiety around interviews and role transition and all of that stuff. So because we tackle those things directly in class, I probably hear a lot about it. And students get pretty comfortable and I think share how they're really feeling about graduation and first jobs and all of that stuff. So, yeah.
But isn't that a part of becoming a mental health?
Yeah, absolutely. No, you
therapist?
have to do it, right? You have to do that sort of self-reflection, I think, to be able to practice for sure. So, yeah. Yeah, so I'm both looking for it and then hearing about it quite a bit. I have my own bias in what I'm asking for, but yeah.
All right.
Absolutely. It's been delightful talking to you. Thank you.
Anything else you'd like to share? Or?
No, I've really enjoyed I guess I do emphasize reflecting on practice, and so I've gotten to reflect on my own